O sunumlardan çıktı alıp ders esnasında üzerinde not alabilirsiniz. Yani benden soruları buydu. Okay. If you have any question, I'm ready to answer. Not have any question, I'm ready to start. Okay. In this lesson, we try to talk and learn different things about urinary system. This is the first lesson of the urinary system. We summarize the urinary system in 2 lessons. This is the first one, and one of, I think it's our lesson next week, and 2 lessons for female genital, male genital, and the last lesson of us is about the pelvic and perineum. Let's look to the system. In this lesson, I try to speak about the general function of this system, try to describe the internal and external anatomy of the kidney, the vascularization of the kidney, and identify and describe the functional unit of the kidney that names as a nephron. As I mentioned before, we divided this lesson into different parts: introduction, general structure, covering of the kidney, relationship of the kidney with the different organs and different structure in the body or in the abdomen, internal and external feature of the kidney, vessels of the kidney, and in the second part of the lesson, we talk about a nephron. Totally waste product of the metabolism are toxins or some waste material after using a protein in the body or something else. For example, carbon dioxide, ammonia, or something else is produced in the body, removed from tissue by use of blood and lymphs, and at the end, this waste material removed from the blood and lymph by use of 2 different systems: respiratory system and urinary system. The waste material is in a gas form, is excreted by the respiratory system, and the soluble material or waste material inside the blood is excreted by or limited by urinary system. We have a different nomination in the function of the urinary system. For example, excoriation, elimination. Excuse me. Okay. Excoriation is the removal of organic waste product from the body fluid. Elimination is the discharge of waste product into the environment. It's the last function of this system. Hemostatic regulation of blood plasma is another function of the system that done this function by regulation of the blood volume and pressure by use of different hormones, regulation of the plasma ion concentration by absorption or reabsorption main ions from the filtrate. Excuse me. Okay. Stabilizing blood pH by use of hydrogen ions and conserving nutrition. Excuse me for interruption. Your classmate tried to come into the class. The elimination of waste products is made by a group of materials. For example, nitrogenous wastes, toxins, and sometimes different drugs. Another important function of this system is regulation of the erythrocyte production by use of a hormone that names as erythropoietin hormone. Erythropoietin hormone produced in the kidney release if blood oxygen level fall and stimulate the red blood cell production center in the body, which is red bone marrow. Okay. Overall, totally, the urinary system done this function for us. Filters the blood, reabsorb needed water, salt, glucose, and nutrients, and reabsorb them to the bloodstream, regulated the blood pressure by use of the hormones, excretes waste from protein metabolism, for example, urea, and regulates the pH of the blood, have endocrine function. For example, it's components, main components of renin, angiotensin cyclus, and secreted the erythropoietin and produce the active vitamin D. These are the summarized of the function of this system. The system is made of different organs. It's start by kidney, pass through ureters, urinary bladder, and with urethra. Kidney, ureters, and urinary bladder is same between the two gender, but urethra during the developments of the fetus is developed by at the same time with the external genital organ. For this reason, urethra in female is different than urethra in the male. But you had to know that the primary organs of the system is kidney. It's filtered waste products from the bloodstream and convert the filtrate into urine. Another parts of the system generally named as a urinary tract because the produce of the urine totally is the function that done in kidney. Another part only transport the urine from the kidney to the outside of the body. Look like another system, we can divide the organs into two groups: primary organs, that's kidney, and urinary tract. If you remember, in the respiratory system, we divide the system into main organ of exchange as a lung and the respiratory tract, and divided them into upper respiratory and lower respiratory. This is the dorsal view of the system inside the abdominal cavity. This is the location. Let me take the laser pointer. This is the location of the left and right kidney. The right kidney totally located lower than the left ones, about 2 centimeters, because due to the weight of the liver. It's occupied the upper part of the abdomen. You can see the both side projection of the both side ureter. you can see that the ureter in the left side is longer than the right side. It's about the position of the right kidney. And the last one, or the last part in the pelvis cavity, the organs located inside the pelvis cavity is urinary bladder. Let's take a look to this organ inside the abdominal cavity. If I dissected the anterior wall of the abdomen and dissected another organs, generally is about a digestive system, I can see the kidney in both sides, in the deep part of the abdomen, and for example, suprarenal gland that's seated on top of the two kidney, the arteries and veins that supply blood for each kidney, the right and left ureters, and urinary bladder. Urethra is the last part of this system, but it's different, as I mentioned before, it's different between the genders. If I summarize the organs and the function of that, I can say that kidney produce urine, ureter transport urine toward the urinary bladder temporarily stores the urine and elimination the urine, and urethra conduct urine to exterior. It's the photo of a cadaver. You can see the aorta in the right side, inferior vena cava in the left side. This is the emerge side of the renal artery. Right renal artery and left renal artery is give off from the abdominal aorta, and the veins of the rain comes and drain into the inferior vena cava. You can see the location of these two organs, the suprarenal gland in one side, two ureter, as I mentioned before. One of them is longer than another. The longer ones is the left ones, and the shorter one is the right one. Inside the pelvis, we have a special organ named as a urinary bladder. Urinary bladder have a different shape. Please be careful about that. It's empty or it's full of with urine. Have a two different shape, look like a stomach when it's full up with the bolus or when it's empty. Let's look about the details about the kidney. It's a paired organ. It's a retroperitoneal organ. The anterior surface of this organ is covered by the parietal peritoneum. Posterior surface of this organ being in contact with the posterior abdominal wall. It's located to the lateral of the vertebral column at the level of the T12 to L3. Right kidney about 2 centimeters, located about 2 centimeters lower than left one. As I mentioned before, it's about a location of the liver. Liver occupy the right upper quadrant of the abdomen and push the right kidney down. Adrenal gland or suprarenal gland located on the superior pole of each kidney. This is the posterior view of this organ. You can see the neighborhoods of the fluctuant rib with this organ. 11th and 12th rib are partially protected this organ, but in the left side kidney is protected by the 11th and 12th pair but in the right side, it's only protected by the 12th. It's important point. Keep this fact in your mind. Right kidney is slightly lower due to the location of the liver. It's so important you had to know it. These two organs have located nearer to the diaphragm. For this reason, during the respiration, both kidney can move downward in vertical direction as much as 2.5 centimeters. It's important because sometimes in the at dorsal side, when the doctor is trying to find the projection of the kidney, the patient had to stop the respiration for 1 or 2 minutes to find the location of kidney. It's important before the surgery normally. The medial side, on the medial side or on medial border of each kidney, we have an entrance, look like another organs. It's named as a hilum. It's the site for entrance or exit of arteries, veins, vessels, lymphatic vessels, or some special structure look like a renal pelvis. Also, this site is covered by the fat. And this fat goes inside and continues in the internal space of the kidney that famous as the renal sinus. If I summarize again, we can say that this bean-shaped organ have a two surface, anterior surface and posterior surface. Both of these surfaces smooth, have two margin, medial margin and lateral margin. We have a hilum structure on medial margin of both sides, have a two extremities or ends, or generally famous as a poles, have a superior pole and inferior pole. The hilus is important site. You can see it in there or in another kidney. It's located in this side. It's entry for renal artery and renal nerves, and exit site for renal vein and ureter. On the medial border of each kidney, you can see the location of the hilum. The hilum extends into a large cavity called as a renal sinus. The hilum transmits the renal vein, the two branch of the renal artery, ureter, and the third branch of the renal artery from the front to back. Vein, artery, ureter, artery. It's the position of the structure, respectively, from the anterior to the backside. Another important things you had to know about the kidney is about the covering of the kidney. The kidney is surrounded by the different tissue from the deep to the surface. First of all, I can talk about the fibrous capsule or renal capsule. It's a dense, irregulated connective tissue that directly connected to or covered the surface of the parenchyma of the kidney. You can see in the right side as a black line that directly connected to the outer surface of the kidney. The second layer after the fibrous capsule is perinephric fat tissue or adipose tissue. You can see it in these photos between this right line that names as a fascia renalis and fibrous capsule. Between them, we have a perinephric fat tissue. Sometimes perinephric, sometimes perirenal fat tissue. Both of them is the same. Completely surrounding the kidney and goes inside. This adipose tissue goes inside from the hilum and fill up the sinus cavity inside the kidney. After discovering, we have another cover. It's so important and named as a renal fascia. This is marked as a light blue or white. You can see between the two layers of the fat, we have a renal fascia, and it's made of the two layers, the anterior layer of the renal fascia and posterior layer of the renal fascia. Okay. It separated the renal ran or kidney from the anterior side structure, for example, peritone, and the posterior abdominal wall, or the structure that's located in dorsal side of this organ. Above this structure, we have another cover that names as a paranephric fat. It's so important. Be careful about the nomination of the perinephric, paranephric. Peri is the prefix in Latin that means that surrounding the somethings. Perinephric fat is the adipose tissue that's located directly surrounding the kidney. But para is the structure located above something. This paranephric fat tissue generally located in anterior surface above the renal fascia. For this reason, it's famous as a paranephric fat tissue. Paranephric fat tissue is filled the space between the peritone and renal fascia. It's so important, and we had to dissect it. For example, in patient, if we are use the approach comes from the anterior and try to do some things on kidney. We had to cut this layer one by one. You can see the axial section. As I mentioned before, in this slide, you can see the fibrous renal cover, the perinephric adipose tissue, and this one is the renal fascia. Above that thick layer is the layer that names as a peritone. Between the peritone and renal fascia, we have a pararenal fatty tissue. Sometimes pararenal fatty tissue is not numbered or not count to the covers around the kidney. Look like it. If you see it, don't confuse. It's the difference between the references in anatomy. For this reason, I use it in my slide. Sometimes the cover of the kidney is counted as a 4, sometimes it's as a 3. You can see that we can divide the surrounding fascia into renal fibrous capsule, adipose capsule, and renal fascia. Adipose capsule is the layer that we know that as a perinephric layer. Sometimes in some references, it's named as a adipose capsule. Renal fascia are made of the 2 layers. It's a spatial section you can see in the right side. It's the sagittal section, but not median, mid-sagittal section. It's a spatial sagittal section to seeing the covers. It's the cross-section of the suprarenal gland. It's the cross-section of the kidney. And you can see the layer, covering layer one by one. Renal fibrous capsule fits the kidney tightly, but is not bonded to it. Once incised, it can be easily stripped. You can see it in here. Continues with outer coat of the ureter and a barrier against a trauma, or maintains kidney shape. The second layer, or adipose tissue, is named as a perirenal fatty tissue, is in immediate contacts with kidney, ureter, and suprarenal gland, extend through the hilum and fill the sinus renalis, or renal sinus. And in renal sinus, all of the structure, for example, renal vessels, lymphatics, nerves, and calyx is embedded in this fatty tissue. Excuse me. This structure at the same time protects the kidney from the trauma and hold it in place. It's another important function of the perirenal adipose tissue. Renal fascia is the thin layer of connective tissue that anchor kidney to surrounding structure and abdominal wall. You can see the two layer of this fascia in this photo. This is the anterior layer of the renal fascia, and this one is the posterior layer of the renal fascia. Another important point you had to know about this fascia at the same time covered the suprarenal gland and continues inferiorly. We talk about the two layer of that, surrounds each kidney as a separated sheet, must be incised in any operation on the kidney, whether from an anterior or posterior approach. It's different approach. It's about surgery techniques. For the surgery of the kidney, surgeons sometimes use incision from the posterior abdominal wall. In that approach, we had to cut or incise the posterior layer of this fascia. Sometimes use another approach from the anterior abdominal wall. These had to replace the small intestine. After that, cut the layer one by one. First of all, parietal periton. After that, had to dissect the adipose tissue, and finally had to cut the renal fascia, or anterior layer of the renal fascia. We talked about that before. You can see the cross section. Please be careful about the section we are seeing in each slide. This is the horizontal section or axial section, but another one is spatial sagittal section. The renal fascia superiorly, this two layer emerge at the over of the suprarenal gland, as I mentioned before. Inferiorly, two layers meet below the kidney, except where the ureter lives. Because the renal fascia is open below around the ureter, infection around the kidney may descend into the pelvis, and in opposite direction, infection in the pelvis can ascend up to the kidney. You can see the inferior side of this two fascia. It's not exactly closed. It's opened around the passage of the ureter. Another important point that I like to say is that the relationship between these organs and another organs, because it's located posteriorly, the anterior surface of that is covered by the periton, but different organs be in contact with the anterior surface of this two kidney. In the left side, and in the both kidney, the upper part or superior pole is the site for the setting of the suprarenal gland. You can see these two location that colored with yellow. The purple side is the side that be in contact with the inferior margin of the spleen. We have a special site in the left, in anterior surface of the left kidney for the sitting of the guster. The tail of the pancreas be in contact with the, or neighbored with the hilum and anterior surface of the left kidney. In the lateral border of the left kidney, we have a special site that be in contact with the left colic flexure and have a big side that be in contact in normal condition with the ional bulbs. In the right side, we have a big side for the sitting or be in contact with the liver, have a little area that be in contact with the C-shaped organs that names as a duodenum, and a light blue part is the side for the setting of the right colic flexure. It's so important, the colic flexure in the left colic flexure be in contact with the left kidney, right colic flexure be in contact with the right kidney. You can see the same things. Suprarenal gland and the site for the sitting of the colon is same, is colored by the same in both sides. In the left side, we have a vast majority of organs, for example, spleen, stomach, pancreas, yenu. But in the right side, they are limited. Only we have a big side for the sitting of the liver and special side around the hilum of the right kidney is the side for the sitting of the duodenum. Please be careful. The duodenum sitting on the hilum of the right kidney, compare that the hilum of the left kidney is generally neighbors with the tail of the pancreas. It's a dorsal view, and it's the different muscles or structure be in contact with the dorsal surface of the kidney. As I mentioned before, the left ones be in contact with the 11th and 12th rib in the left side, but in the dorsal surface of the right kidney, you can only see the projection of the 12th rib. Another neighbors in this side is generally muscles. For example, in this side near to the hilum, the psoas major muscle is located in dorsal side. This yellow part is the part that be in contact with the quadratus lumborum muscle, and in lateral side is an important side for the sitting of the another muscle inside the dorsal abdominal wall. If I see the sectional sagittal section of the kidney, I can explain that we can divide the kidney into lighter outer surface or lighter outer part named as a renal cortex, and the darker inner part that names as a renal medulla. Inside a renal cortex, we can't see any major anatomically or morphologically anything, but in medulla part, without a microscope, you can see the spatial pyramids and a part of cortex invaginated between them. This part or invaginated part names as a renal column, and this darker part names as a renal pyramids. Totally, we have 8 to 15 renal pyramid in each kidney. The base against cortex and apex of this pyramids is called as a renal papilla and directed internally to the internal side of the kidney. Another things I can see on the mid-sagittal section is the different part of the tracts. The first part of the urinary tract is started with the minor calyx. That's we funnel shape part receive renal papilla inside it. Each part, this one, and this one, all of them names as a minor calyx. Two or sometimes three of them comes to each other, connected to each other, and make a major calyx. You can see in there or in there. Major calyx merge to form renal.
Hocam sesinizi kapadınız.
Why do that? What's the last things do you hear? I think in this part, I close my voice. Do you have any idea? Please write me for chat box, from chat box, or open your voice and tell to me.
Sonraki sınıfta kalmıştık.
Excuse me, I can't hear you.
Hocam bir sonraki slaytta gitti.
There
Yani
or
bir sonraki slaytın başında.
There. Okay.
Evet, burada.
Thank you so much. We talk about different parts of the urinary tract in this slide. Urinary tracts part start at the level of the minor calyx. It's a funnel shape part that received renal papilla. Each one of this structure is named as a minor calyx. Then sometimes both or sometimes thirds of that connected to each other and make a big part that names as a major calyx. Major calyx merge to form a last part or the big part that names as a renal calyx. We have another term is so important, it names as a renal lobe. Each pyramid and related cortical region, for example, I can draw look like it, names as a renal lobe. Each pyramid and the cortical layer, patch it or cover it, is named as a renal lobe. Generally, in one kidney, it's consists about 8 to 15 lobe. Okay. It's the cadaver photo. You can see the different structure inside the kidney. This space, excuse me, this space named as a, excuse me. Pardon, online dersteyim, birazdan sizi arayayım. Rica ederim. Excuse me, I had to answer it. The outer layer or the lighter layer named as a cortex. The separation that comes from the cortex is named as a renal column. You can see the renal pyramid. These are the darker pyramid shape part in the cross section of the kidney. Each pyramid and a related cortex is named as a renal lobe. On this cadaver photo, you can see the minor calyx in this side, this one, and after that, this minor calyx connected to each other to make a major calyx. Then you can see the renal pelvis. All of the major calyx connected to each other to make the renal pelvis. Then it's continue as a ureter and leave the inside the kidney. You can see the another atlas photo of this side. You can see the perirenal fat tissue is filled inside the sinuses. This is the renal artery, renal vein, and as I mentioned before, it's the minor calyx in this side, major calyx, and then connected to each other to make a renal pelvis. As I mentioned, the renal parenchyma is divided into cortex and medulla. These two tissues have a different function. In cortex, where the blood is filtered, and in medulla, generally we have a collecting duct which carried filtrate to the pelvis. Renal pelvis is a big part, funnel-shaped part, is expanded upper and expanded upper end of the ureter. If you see in this direction, or the pelvis become narrower and made the ureter. I talk about the renal sinuses is the space between the parenchyma and collecting or renal tracts in this side, and in normal condition it's filled with the perirenal fatty tissue. We talk about the different things in cortex. The cortex functionally contains renal corpuscle. It's the initiate part of the nephron and convolute portions of the renal tubule, that both of them is seen microscopically, or you had to close look to the cortex of the kidney. In the medulla, we talk about the pyramids. The pyramids have the base part. The bases of all pyramids, if you imagine three-dimensionally, the base of all pyramids is looked outside, and the tip of the pyramids is directed inside the organ. This pyramids or medulla part contains descending and ascending limbs of the renal tubule or Henle loop, collecting tubes, and medullary rays that we mentioned in our next slides. Renal papilla is so important part, and we know that as a tip of the pyramids. This side is a renal papilla. You can see it in here, in here. Each pyramid have a tip, and this tip named as a renal papilla. On the surface of the renal papilla, we have a foramina. That is the ending part of the collecting canal. The urine comes inside after produced inside a nephron. It's come inside a collecting canal and transferred into the foramina. After that, exit from the foramina and comes to minor calyx. It's so important point. You had to know the produce center of the urine, the transfer of the urine inside a tube in minor structure and in anatomical part. We talk about the renal lobe. We talk about the renal pelvis. It's located in here. Minor calyx, it connected to each other, then made the major calyx. Major calyx connected to each other to make a pelvis, and these are comes down and continue as a ureter. As I mentioned before, this foramina totally names as a cribriform plate, but each one is the papillary foramen. This is the site that the urine is leave the parenchyma and goes inside a tract to transfer into the external side of the body. We talk about all of them, and we can have a 10 minutes break. Please be